How's your arm feeling, Mark?
It's feeling better. That's why I thought I'd just get a little bit on a level playing field. Because for a minute I was thinking, why isn't everybody laying down right now?
You know what? It's called the vagal basal response, is where you kind of get into your head like, oh my gosh, I get poked by a needle. Yeah.
Can I ask you a question?
Yeah.
You're vegetarian.
For the last 8 or 9 years.
Yeah. So like, what made you go from being, I guess, an omnivore to then?
Yeah. Okay. So mine was kind of health related.
Okay.
I was traveling to North Carolina, and there's a lot of hikes and waterfalls out there.
Yeah.
And I decided to jump into a waterfall. So much fun. Don't regret it. But I got bit by a tick. So when I came back to Arizona, I was in Arizona at the time, and I was doing schooling there. So when I came back, they were suspecting that I had Lyme disease or Rocky Mountain spotted fever, like Lyme disease, or ticks carry a lot of disease. So they had to put me on a preventative measure protocol because I didn't keep the little tick. I just peeled it off and I knew I got bit.
Oh.
So when I went back to Arizona, I broke out in a rash from head to toe.
Really?
And so they had to put me on really strong antibiotics for 6 months to make sure I didn't have any side effects. So if it was Lyme,
right.
Yeah. So at that point, what happened was my digestive tract stopped working. I couldn't digest meats anymore.
Right.
And that kind of I quit cold turkey, and then it just sort of became a lifestyle.
Because they're harder to digest.
They are
and
hard.
absorb?
Yeah, exactly. And then antibiotics completely tear up your gut. So you know this good bacteria we're talking about?
Yeah.
Antibiotics completely flush it out. So, and then your body's like, literally I would eat meat and I feel like it just stuck right here. Like I couldn't digest it. And so
Did you ever try to reintegrate the meat into your food, I guess your diet?
Yeah, I haven't yet.
Okay.
I think about it at times, but I haven't.
Can we have a steak after this?
No, not today. Maybe in another lifetime. I don't think I could do anything.
Probably because you don't have the bacteria to digest it, you probably would struggle the first few times you would eat the meat.
Probably, and I don't think I could physically make myself eat it now.
Yeah.
I think it's just
Lost that appetite.
Yeah, exactly. It doesn't do anything. People always used to say, "Don't you miss it? Don't you want to eat it?" I'm like, no, I don't miss it. And I used to be an avid meat eater growing up. Yeah.
It's mostly just the smell and the sensation of the texture, more than it is that you're eating what it is that you're eating, right?
Yeah. I think now in my brain, when I went vegetarian, I watched some documentaries on things that I shouldn't have watched. But anyways, the dairy industry or the meat industry, and it kind of just triggered something. And now I look at a piece of meat and I think,
food on mass, how it's made. It's crazy.
So question for kind of your operation in your system.
Yeah.
When did you guys get started and where are you guys looking to take this business?
Yeah, so I've been in practice for 10 years. When I first moved here, I worked in another clinic. I was there for a year, and very shortly I found out I couldn't work for somebody. It was just the environment was not good. And so then I co-opened a medical clinic with another medical doctor. We ran that for 4 years together. I was the only naturopath there. Right. And then I moved into this place last April.
Oh, wow.
Yes, so I was working out of an office on King George and 88th prior to this. So this is a newer location. Where I see this going, at this point, I have no idea.
Yeah.
This is I come into work and I love what I do and I love this space, but I want to expand maybe in my hometown or maybe across the border. And the reason I say that is across the border, my scope is a lot more open, so I can actually have easy access to stem cell therapy or different types of injection therapies. And possibly something back in Calgary just to support my fellow Calgarians. Yeah.
Okay, you know what? I want to touch on, what is it, TRT or human growth hormone? And then stem cell.
Okay.
Stem cell replacement.
Yeah.
Right? I've heard that it's pretty miraculous and not very regulated in the States, but you can go to other parts of, I guess, the world to get stem cells replaced.
So I learned under a doctor in the US. My residency was in cancer care, chronic disease, and I did a lot of pain management during my rotations in school. And so there was doctors that we were training under that were doing stem cells at that time. I don't know about the difference between the regulations. I just know it's not as open here in Canada and people are having to travel for it.
Yep.
It's not as, I don't want to say legalized, it's still very legal, but they still have a lot of constraints around it.
Like regulations.
Yeah, regulations. I'm not allowed to practice stem cell therapy here. Across the border, I am.
That's crazy.
Yeah.
Because it's supposed to be beneficial for people that are going through cancer or other type of medical problems.
Not even medical problems. It's so amazing in prevention, pain management. Like, say you've got something going on with a joint.
Arthritis.
Arthritis. So basically what it is stem cells our bone marrow makes. Every cell in our body is made up of a stem cell. Stem cells, you can think of them as baby cells. And basically, if you inject that stem cell anywhere in your body, it's going to eventually turn into that cell. So if I put it in my elbow, it's going to turn into that cell. If I put it into a forehead wrinkle, it's going to fill up my forehead wrinkle because it's going to turn into that cell. Wherever it goes or migrates, it literally like turns into, So imagine you're an athlete and you're having issues with your knee, but you're so young and you don't want to do surgery because you don't know if you're going to heal from it. Stem cell is a great option because it will actually not only like heal the area, it will decrease inflammation, it will build cartilage, it will help with the inflammation around the tendon. Like it just works miracles. Nowadays, they're also doing stem cell IVs, which I'm not allowed to do here in Canada, but that's also great as you get an IV of stem cells and the stem cells go where it needs to go and heal, decrease inflammation in the body. It works amazing.
So you could put stem cells into the blood?
Yeah.
And it'll just travel to
where your body needs it. Like
does it go to where the body needs or just overall just improves the health?
I think it all overall improves the health, but I also feel like our body has the innate ability to heal itself. So if there's an area where you need extra stem cells or needs repair, I feel like, I feel like our body is smart enough to take it.
Yeah, that makes sense to me because if you're like, if you have an injury, there's more blood going there.
It is, because it's inflamed.
Exactly. So all the stem cells.
All our immune cells are going to that area and trying to heal it. Like, you injure your knee, all your immune cells are going to run to your knee to try to heal it. Same thing,
Our bodies are pretty miraculous, pretty magical, like, I have to think. We got a poke in our body right now, right? Once we take it out, there's going to be a little bit of blood coming. But what's going to happen is the pellets are coming, the white blood cells are coming in just to fix it all up. Blood's going to coagulate. And I'm thinking, there's got to be some sort of magic trick. Like our body just does everything on its own.
You know what? If we supported our bodies how it needs support, we would never be sick. We would be so healthy. We would live years and years and years. We wouldn't even age. It's these things that we do like in our external environment or what we put into our body that causes an imbalance in our body. That causes all our issues.
Sure. That's awesome. Cool. How's your arm feeling, Mark?
It's feeling better. That's why I thought I'd just get a little bit on a level playing field. Because for a minute I was thinking, why isn't everybody laying down right now? Can you take your feet up as well?
I didn't tell you this earlier, but you were a little pale. Did you?
You know what?
I think you were afraid.
I was. It's more fear.
You know what? It's called the vagal basal response, is where you kind of get into your head like, oh my gosh, I get poked by a needle.